More than 90% of COVID cases in our area are the Omicron variant. A big issue doctors are facing is the shortage of the monoclonal antibody treatments that will work on this variant. News 4's Joylyn Bukovac talked to the director of a COVID antibody clinic about why most treatments aren't working on Omicron patients.
The variant is so different that these antibodies can't sort of find a landing place or a connecting area, and so they're not effective.
Medical experts say since only one type of monoclonal antibody treatment is the most effective right now, only people with suppressed immune systems qualify for the treatment.
Historically, we've been using these other two types preferentially. They're the older ones, they're a little more established, we had a larger supply of them. And then this, again, has sort of shifted our needs significantly, and there has been a shortage.
The director of Vanderbilt's COVID infusion clinic says the surge of Omicron cases has caused a shortage of Sotrovimab, the one monoclonal antibody treatment that's been preventing Omicron patients from becoming seriously ill.
We wish we could treat everybody, or at least everybody that meets the emergency use authorization criteria. But because of shortages in this treatment, we are only able to offer it to those who would be at the very, very highest risk of hospitalization and an adverse outcome.
Sotrovimab is the only antibody treatment doctors are giving out right now, since the Omicron variant is accounting for more than 90% of COVID cases in our area.
We have been told that at this point, essentially everything that's being detected is Omicron. So we are just assuming that only the single antibody is going to be effective for the vast majority of patients.
Sotrovimab is the newest treatment that was cleared back in May and was already in high demand before Omicron became the dominant strain, so the supply is now very limited. Doctors are having to save the treatment for patients who need it most.
So the criteria have been really tightened up, and we're focusing on those patients who would be least likely to be able to mount their own immune response if they got natural infection or were given vaccine.
If you are immunocompromised, have COVID, and want to get the antibody treatment, you can be referred by your healthcare provider. Dr. Block says getting vaccinated is still the best way to prevent COVID-19. Joylyn Bukovac, News 4 Nashville.